If you're considering a revision rhinoplasty, you'll often hear your surgeons talk about different sources of material to accomplish your goals. What and why? So we need to often add structure back to a nose because a lot of rhinoplasty can destroy some of the cartilage structure, and we're trying to create the sculpture you want for you. So what is our preferred sources of material? Septum, first and foremost, is usually our go-to for structural grafting of your nose. We're trying to add support back. We want to sculpt a certain shape. We're going to septum first and foremost. The problem is you often had your septum already used with that primary rhinoplasty you had. So therefore, we have to be prepared for using other sources of material. So when we want a lot of structure still, our second choice material is rib, and it could come from you or donor cadaver rib, and they're both fine choices to accomplish your goals. I leave it up to my patients to decide which version is best for them. Other sources of material we can potentially use is ear cartilage, which I think is overall too floppy and doesn't add a lot of structural support, but has a few indications if it's going to replace soft cartilage. And then the last source is fascia, and there's a couple places to get it, usually your scalp or behind your ear called the mastoid fascia. This is soft material that can be like a blanket, especially for damaged skin. When you have thin areas of skin and you have a lot of irregularities in them, we want to use fascia to help soften those irregularities and give you a smooth overall shape. So these are the different sources of material that we're thinking about as a revision rhinoplasty surgeon that we have to go through with you as the patient as different options and make sure you are consented for that surgery beforehand.